edition. We have in the studio Mr. Olajide Rainy Wilson. He is a clinical embryologist. Mr. Olajide Rainy Wilson. Don't bring down the race today. Good evening. What exactly is fertility preservation?
So it's a process whereby you're able to preserve your gametes, the sperm, the oocyte, that's the egg, then the ovarian tissue, whereby for different reasons, whereby you kept them away for a while, and after a while, when you actually are in need of them, you're able to bring them back to life. So the preservation is a process whereby you take those gametes to sleep for a while, 10 years or thereabouts. Then when you're actually in need of them, you bring them back to life.
What could actually warrant anyone wanting to preserve those tissues like you just mentioned? What could warrant one wanting to preserve them?
Before now, basically it's as a result of for people going through chemo, maybe having for cancer patients, and they're going through different type of treatment, and they will need to preserve those, either their sperm or their ovarian tissue or the eggs, so that after the chemo there is some effect of chemotherapy, radiotherapy, and which might actually affect their,
destroy the potency of those tissues.
So they keep them away, and after the treatment, and they are now fine, and they want to have their own children, and so they can bring them back to life. Also now we have more of social freezing. Now it's very difficult these days actually to get into a relationship and probably getting married, and some want to focus on their career, academics, and so you just want to either you want to keep the sperm, the egg, till later time, because by the time you get to that age of say 35 to going to 40, it's more difficult getting pregnant. So at a younger age, maybe before you clock 30, you want to preserve it, or maybe at the early 30s you just want to keep it. Who knows, probably when you're now ready to get married and you want to have your own children, you might be having difficulty, but you have something to fall back on.
You're not thinking of marriage, you want to focus on a career, you preserve them until when you need them. So when you now need them, what happens to it? It is implanted back into that individual?
Okay, for the eggs, for you to generate those eggs, you have to go through the process of IVF. You stimulated like someone that is going through normal IVF cycle.
Yes.
And eventually eggs are generated and they are frozen. So which means when you're coming back, you're still going through the route of IVF.
The reverse of...
yes, IVF to be able to get pregnant. However, ovarian tissue is actually different, whereby tissues are taken from the ovaries and preserved.
Yes.
And it can be implanted back, and you can conceive naturally.
What are the advantages of preserving one's fertility?
For people undergoing chemotherapy, it's a great advantage for them, because they're able to keep those tissues for a while and be able to fall back on them. Also, for someone that wants to focus on their own career, and for one reason or the other, or probably you're looking at, I don't know when I will actually want to start making babies, I don't know how soon it will be, so it's better for me to just keep those tissues and the eggs for a while, and subsequently be able to fall back on that. So for that one, they call it social freezing. Before now, it's not something
How popular is social freezing right now?
Now it's getting, in Nigeria, well, the awareness is gradually picking up. Before now, it's not something that it's that popular. Because people have concerns about what are the successes, what are
the risk, downsides.
The downside of freezing your eggs. But before now, it was actually pretty difficult freezing eggs. But with advances in technology, cryopreservation, it's much easier now to freeze your egg.
Just mention preservation. What exactly is that?
Cryopreservation means the use of liquid nitrogen, bringing it to like minus 30 degrees, which means you take those tissues to sleep in active stage. So the egg that was probably frozen now at age 20, you take it to sleep. So when you thaw it out 10 years after, it's still looking at age 20 egg. So it's not growing, it's not dividing, it's just left in a very in a dormant state.
Yeah.
With the advances in that technology of cryopreservation, we have what they call vitrification, whereby the fluid inside the egg is actually turned into like glass and taken to sleep. So whereby when you're bringing it back, they call it trying to recover it back. The recovery rate has actually been fantastic with vitrification, which makes it much easier, a lot easier to freeze eggs and bring them back to life.
Yes.
After which your potential husband or the person that you want to father your child, bring the sperm, then the sperm is taken into the egg through the ICSI process, and you generate embryos, and from embryos you transfer it back to the woman. Voila, the baby is here. Some of the things it will be able to solve is it's much easier for you to have your own child when you desire, which against I need to say that even if you need to also opt for this option of preservation in terms of freezing your eggs, it is advisable you do that at a earlier age, because the chances,
especially for the female.
Yes, because it's much better before age 30. It's okay before 35, but as you cross the borderline from 35 upwards, the chances also, because the quality of the eggs also drops, and also the quantity in terms of the numbers of your ovarian reserve also get depleted as you age. For someone that is around before 30, if you freeze like 20 eggs, your chances of getting pregnant when it's thawed out is about close to 30%.
At below 30?
Yes.
Wow.
It's about 30%, which is closely at par with doing in a fresh cycle.
Yes.
But by the time you cross 37, the chances of getting pregnant from a cryopreserved egg, it's much lower than 20. So it's much advisable to do your fertility preservation much earlier.
Let's go above 35.
Okay.
What are the chances? Is it a completely helpless situation?
No, it's not an helpless situation. Even at 40, it's not as if you can preserve your eggs, but the chances are really.
Now let's look at the risk component of this process.
There isn't much risk attached aside from the stimulation process, which comes with normal IVF procedures. Yes, maybe over stimulation, OHSS, which are people over respond to drugs, which it's something that we can manage very well, yeah. And the other part is the risk that comes with every procedure. You don't expect to freeze 10 eggs and actually expect the whole 10 to come back as okay. So it's expected that maybe about 10% for 90% recovery rate for eggs below 30.
Yes.
Say 85 for between 30 and 35, but for 37 upward, probably you're looking at probably 50% recovery, and so those are the risks that actually
the downside to the procedure.
But it's something that we just need to walk the patient through for them to have a proper understanding.
How affordable could this be?
Well, for cryopreservation is very, very affordable. Probably the most of the cost will be for the stimulation, the IVF.
Long can these eggs be preserved or frozen for?
In UK, for social freezing is about 10 years, but you can freeze as long as 20 years, but you need to pay the landlord rent.